I'm joined by Katie Cunningham from the University of Iowa Health System. We've had the chance to work on a large initiative over the last few years, but still curious at the beginning, a little bit of history about you for those that don't know you that you think would be relevant.
Sure. I have spent about 25 years in different marketing and PR positions in healthcare. So most recently, before I came to University of Iowa Healthcare, I was at Marshfield Clinic in Wisconsin. Mm-hmm. When I started at Marshfield, we had 2.5 hospitals, and when I left 5.5 years later, we had 11. Okay. So
a lot of growth.
Got to experience a lot of very rapid growth and everything that goes along with it. So that was exciting.
And now at University of Iowa, I did see most trusted brand?
Yeah. Monagle does a survey every year, and this past year we were named the #1 most trusted brand in the country, healthcare brand, which is exciting. That really means a lot to us.
Absolutely.
It says a lot about what people think of us and the amount of trust they put in us in Iowa. So we were really proud of that.
And I'm curious, so the work that we were doing together was really around realigning the health system toward more closely aligned to the university brand.
Correct. Yeah.
How did that decision come about?
So that was an interesting journey. I've actually only been at UI Healthcare since spring of 2023. Yep. So it started, I think, 4 or 5 years before I got there. But the university made the decision to rebrand pre-COVID, yep. And they actually started that process and started changing things over then. And of course, we wanted to stay aligned with the university. Our brand is very strongly associated with the university, and that's important to us. It's important to our position in Iowa and how we help improve the health of Iowans. However, COVID hit, and we had a few other things going on, so that kind of put that on the back burner, unfortunately. I know that we engaged Brand Active in the planning process for that, which was a huge undertaking, just huge. And, the strategy and the thinking behind making the decision to move and how to do that took several years to work through. We actually also worked with SPM Marketing, which is now part of Unlock Health, yeah, on that strategy as well. So we had a lot of partners involved in this. And it took years in planning, really, just to think through everything, to consider all of the different people in different parts of the organization that would be involved in this kind of change, to really think through why we were doing it, think through what types of sub-brands we wanted to have or not have, to think through job titles and, what goes on the side of a helicopter and all of the different things in between. So in a way, I think we're kind of lucky we had the time to plan for it.
Absolutely.
And I think it was just thinking about everything that went into this was amazing. And then we were supposed to start the actual rollout of the new brand identity last July.
Right.
And we had to pivot. As you know, we ended up acquiring a community hospital in Iowa City, Mercy, Iowa City, and they were having some financial trouble, so we needed to move that forward pretty quickly. Yep. We ended up, because that ended up happening, they became part of University of Iowa Healthcare at the end of January this year. Then we decided to move the part of the rebrand up, like 5 months.
Right.
So we were kind of building the plane as we flew it. Did that, and your team was right alongside of us through that. Bless their hearts.
Well,
so yeah.
Were there surprises along the way? Besides an acquisition coming in, but like around the complexity of how much there is, or how difficult this was, or internal stakeholders that you needed to bring along. Was there anything that?
I think just the scope and scale of it. I mean, we're talking to people in our laundry about lab coats. We're talking to just so many different people across the organization, and you touch so many processes and so many things that you just don't realize how complex it is. And, we're really just getting started. It's going to take us 3 years or so to finish this. And I've learned a lot. I mean, I came in right as this was starting, so I learned a lot about the organization very quickly and got to know a lot of different people in the organization quickly because of it, which was great.
Had you been through a transition like this before at Marshfield or any?
I had not. I had not. So, we were involved in branding. We actually considered changing the logo there and ultimately decided not to because of the cost and the scope and scale of the work. So this is my first time through an experience like this. Yeah.
I think it's great. I mean, first of all, you're doing an amazing job, but you're also looking at not just how do I convert the things that I have, but also how do I improve the things
exactly.
that I have, which
exactly.
It's one of those things that a lot of healthcare, or let me just say, a lot of marketers in general don't take the time to really look at when they're going through a massive conversion, because there's so much to do just converting what they have, as opposed to focusing in on the assets themselves or wayfinding improvement or things of that nature that you're working on.
Yeah, and that's actually been great that we were able to do this. I mean, one of the benefits of going through a change like this is it gave us an opportunity to really ensure that we had an accurate inventory of what we had, that we could go back and look at, does this make sense? Are there things we can make better? And even just put written processes in place around things. Because that in a large institution, there's always sort of those things where nobody quite knows who is responsible for it. And this really gave us an opportunity to clarify some of that and work across departments to do that. So I'm excited about that. I actually think that's really going to be a huge benefit to the organization going forward.
Yeah. I mean, especially when you're going through, you just made another acquisition.
Yeah, we did.
Example.
Well, we're in the process of it. Yes.
Yeah. So as those things come on board and you start integrating more things, it makes that process of integration easier as well.
It really does. We also have a new hospital that we're building that's scheduled to open next spring. And it was interesting because some of the discussions around the branding and the signage on that hospital happened before we had some of the work done with Brand Active around our standards and things like that. And it was a more challenging conversation than it probably needed to be because we just didn't have some of these things in place.
Right.
But it allowed us, those were some of the points where it's like, well, I don't know. Is it visitor parking? Is it patient parking? I don't know. We should really write this down. We should really figure these things out so we don't have to keep asking these questions over.
Lexicon and nomenclature is so simple, and it still takes a long time to figure it out.
Yeah. So, we've been learning a lot along the way. And I think every time we do one of these, we're going to learn a little more. But I'm, and I'm excited to have, kind of build something that hopefully is going to help make the organization better forward.
I'm curious, when you say, most trusted brand, make the organization better, right? You've implemented a new brand, you've made some acquisitions, right? Like what is the future of the health system in your mind? And I'm more interested around from the academic medical center, because I think, when an academic medical center aligns itself to a university, there's sort of a regional association that happens in that process, right? That says, okay, well, we are Iowa, right? And now, obviously, I mean, there's Hopkins and stuff like that, which has been academic and was able to broaden itself regionally. Is that something that's a focus of the organization when you think of growth, right? Or is it really growth within the community?
We don't talk a lot about growth, to be perfectly honest. We talk a lot about access. And, our mission is really to improve the health of Iowans. That's what we're there to do. And, that's a big deal. And it's a pretty, people feel that. We did a lot of research as part of the rebranding and our brand positioning. And one of the things that really struck me was how deeply our employees feel about that. Like, they have an enormous amount of pride in being able to care for their neighbors. And I think that's something that's really, really critical to the core of who we are. So a lot of what we do is really about and we talk about this, even if people never actually walk through our doors to get care directly from us, we're the only comprehensive academic medical center in the state. Our medical school graduates physicians who work all over the state. We're doing research that really does change the health of people in Iowa and beyond. And we take that really seriously. So a lot of what we're focused on is, and sometimes it means identifying different ways that people can get care from us, but sometimes it's about helping other systems or working collaboratively with other physicians or finding different ways to help, even beyond that, nursing or paramedics or others be able to help care for Iowans better. And so we're always kind of looking at different ways to do that, from helping rural hospitals have an EMR. We support a lot of them in that. To helping ensure that family medicine physicians across the state know how to deliver babies safely and effectively. So all of that is part of what we do to carry out our mission.
I'm really glad you said that. Short sidebar story. When I was doing mergers and acquisitions and IT consulting and stuff like that, one of the projects that I had was at Children's Hospital LA. And I was 23 to 25 years old at the time when I did that, and it was all to implement Cerner at the time, the largest Cerner implementation that had been done. I had never worked in a hospital environment, right?
Oh, wow.
And the impression that I had every single day showing up, like I was nothing in this whole process, but like walking through the hallways and seeing the doctors and seeing the nurses, and the doctors and the nurses were actually on the Cerner team to create this implementation and all of that. And the passion and the drive and the commitment and the day in, day out beating that these hearts took, for me was honestly the biggest part of showing up every day. And I think, we come to a healthcare conference like this and we talk about, whatever this topic is or that topic is. And I'm just glad that you brought that up, because I think it's something that gets lost when we even talk about a topic like that. We do brand implementation and management. We're not changing the lives of people inside the hospital.
I love being adjacent to that. I couldn't do what they do every day. But it's great to be a part of it in the way that I can.
Absolutely.
It definitely kind of creates perspective when you work around people who do that kind of work every day.
Yeah. What, just curious, when you think about the future for you, what are the things that you're passionate about changing, being involved in doing? I mean, obviously we just touched on one, but you're taking this brand forward, you're shepherding this experience forward, you're shepherding the trust of the organization forward from a communications and marketing perspective. What really charges you up as you think about the future?
I think there's a lot of opportunity to continue going down this path with University of Iowa Healthcare. There's so much to do. We're just getting started. We're really scratching the surface on some of these things. I think we really have an opportunity to tell our story in a really powerful way. And really, one of the things we talk about is we really want people, anytime they see that brand, to know what's behind it and know what to expect, when they walk through that door. And there's just so many great opportunities to tell that story and to, help deliver on that every day. And I just love being a part of that. Yeah. And then I am kind of a process and systems nerd. So when we talk about things like creating process and structures and putting some of these things in place, I really enjoy doing that too. So it's exciting to see that, and exciting to, have something that will hopefully outlive me and outlive my tenure at UI Healthcare too. You know what I mean?
Yeah, I know. We get to work on a lot of those things together, which is great. All right, shameless plug. What's the benefit or value of bringing an implementation partner like Brand Active?
Oh my gosh. Having somebody who understands what's involved in this makes a huge difference. Everything from understanding signage specifications and things like that to just the level of project management and complexity behind some of this. I mean, we had at the peak of the work we were doing, I think we had 10 work groups with 10 or so people at each work group. inventorying things, working on changing over logos and things. We had, just all of these people. And I think one of the things Brand Active really helped us do was keep that on track, keep it moving, make sure we were thinking through everything we needed to think through. So from that perspective, I think having someone with expertise in this made a huge difference. From that perspective, I don't know how we would have done this with our own internal team. We have a great team, but this was a huge lift. Yeah. It just was. Yeah.
A health system will spend 10 to 100 times what it spent developing the brand to implement it. So, if the capability doesn't reside in-house.
Right.
Always nice to have somebody on your side.
Yeah, it does. And it makes everything go so much more smoothly. And in the end, I think it's going to be so much more efficient and cost-effective because we had a partner who really helped us think it through and do it the right way.
Awesome.
So, yeah.
Thank you. And thank you for taking the time to sit down and actually have this conversation. This is great.
Absolutely.
I really appreciate it.
Thank you.
Thank you, Katie. Appreciate it.